I'd love to dive deeper into the different types of fillings, because do you want to give my listeners a bit of an understanding on the commonly used ones and the different types?
Of course. So yeah, fillings, the one I was talking about, the amalgam filling, it's the silver filling. So if you have a black silver filling in your mouth, that's probably amalgam. So it's an old school filling. It's still used in dentistry. In Germany, for example, it is a common practice because insurance pays for it. Same in the US. Since 2018, there was the Minamata Convention. They are finally saying not silver fillings anymore. They openly talk about 50% of mercury. Before, it was kind of like just the marketing. There's gold fillings and there's silver fillings. So if you cannot afford gold, you just take the silver. Nobody knew that it's like mercury. So those are the old school fillings, the black ones, the ones that are paid by the insurance. Obviously, we have evolved in terms of materials, and we can use better materials, not just for the structure of the tooth, but also aesthetically and toxicologically wise. So if you get a white filling or a tooth colored filling, then it's most likely a so-called composite. Composite is, if you say it's super easy, it's just basically plastic mixed with ceramics. That's super easy explained, but that's a composite. Yeah, some sort of polymerate and a little bit of organic matrix. And then you can go and upgrade, and if it's becoming a bigger hole. So filling is used if it's a tiny cavity, you fill it up. But if it gets bigger and bigger and bigger, you maybe need an inlay, which is, you could be doing this in metal or in ceramic if it's tooth color. And if it gets bigger and bigger, that's just dental terms, then you need a partial crown. And if the whole enamel is destroyed, you will put a whole crown on top of the tooth. So that you have so tiny filling, then the inlay, then the partial crown, then the full crown. Obviously, the more enamel, it's the hard part outside of your tooth, the more enamel that's destroyed, the weaker the tooth gets. That's totally logical. The amalgam filling, the old school one, gives no stability for your tooth. You basically have a hole and you drill it a little bit with an undercut and you fill it in, and then the material in itself basically dilates and then fills it up. That's the black one. The composite fillings have something, you use a technique, it's called etching the tooth. And you basically bond the composite to the tooth. What it does, it really stabilizes the tooth. Even if you have a bigger hole and you use an inlay or a partial crown, because of the bonding procedure, biomimetical studies showed that if you glue it on top of the tooth gets stabilized again. Obviously not as good as if you have your healthy teeth. I'm talking about reparation here. So the goal for the future obviously is to not repair anything. That's why I'm teaching this. But for now, fillings like black ones and composites. And in my opinion, we shouldn't use any amalgam, obviously, at all for years. And I have never placed any amalgam filling, luckily.
In terms of the toxicology data with the composite fillings, Dom, they're still going to leach plastic into the body, or what's the situation there?
Yeah, so in terms of, let's say, for toxicology reasons, if you compare the amalgam, the silver filling, which contains 50% of mercury, which is the most toxic non-radioactive element known to men, which is gases out of the filling on a daily basis, and you compare this toxicity to the little bit of plastic in the composite, it's about 100-fold difference in terms of toxicology. Like the amalgam is way more toxic. Still, it's really the plastic is really depending on the skill level of the dentist, if he does it properly or not, if it's like doing it fast or whatever, because there's a clear etching or a clear composite bonding protocol with all the materials we use. Obviously, it's chemicals, and it's not perfect, but we need to repair things. So there are tons of different materials out there when it comes to composites. We really have to, what we do, we check for the patient which one works with the immune system. You can use applied kinesiology to test it. With bioresonance, you can also do blood work to check if that's the right one. But if you don't have access to do this individual testing, it's we just go, obviously we don't have any material that contains DPA. So we already pre-select the best composites that work for filling really good, but also work for most people in terms of the immune system and toxicology. The toxical problem is not so bad because if you will always polymerase the materials in there with a UV light. And if you just polymerase it a little bit longer, like instead of just doing 20 seconds, you do 60 seconds, it's already better. And we did tons of testings, kinesiological testings, to find out which was the best protocol and to get the least immune responses. And that's mostly the trick. If somebody has a problem from their composite, just go to the dentist and just let it polymerize one more time. Just go there, 20 seconds of a UV light, and mostly that does the trick, because the only allergical problem or toxical problem is the monomers. Is that the right word in English? The monomers.
Yep.
Yeah. The monomers need to be like tightly bonded. If that's bonded, it's no problem anymore. It's like hard plastic. It's kind of like if you see whatever plastic structure like this, there's nothing leaching out anymore too much.
Would it still be heat resistant as well?
Say it again?
Would it still be heat resistant even if we drink, very hot beverages? It's not going to.
Yes. If it's polymerized completely, it's heat resistant. Totally. There's no, obviously, of course, you bite on it and you maybe grind a little bit down, but I think it's such a minor thing that if your body is healthy enough, I think you can really deal with it. And yeah, of course, there are patients being allergic to their composites, maybe because they were like, the immune system was connected to it or was exposed to the monomers for such a long time or too long, because it wasn't done properly or it was allergic in the first place. Then you maybe have to switch it to another one. And the thing is, you cannot say composites in itself are bad for the patient or good for the patient. It's not correct. You need to use something and then just look what is good for the immune system. And what I always teach my dental colleagues, so in biological dentistry, let's say for the last 10 years, it started with super chronic sick patients. I only saw like the sickest of the sickest, ALS patients, MS patients, like really cancer patients that we really had to do everything and be really precise, take out all root canals, all metals and everything. And obviously this spectrum evolved to all guys like us that are looking for the edge, that are high performers, athletes, people that are just looking for optimal health. And I'm really happy that I don't have to only do the extreme cases, because they are looking for they want to become a little bit healthy and become healthy again, but also the other side that wants to be superhuman. So both is important. We both need a 10 out of 10 and be individual. But what I was always training was, if somebody comes in super unhealthy with an immune system that is already going berserk because of too many things in the body, you cannot put in a composite or any plastics at the moment. And for long term, we only will use temporary phases to let the body heal overall. And basically the immune system will get modulated and easy again, because it's probably the immune system is like used to go berserk, and the nervous system is on fire. All these patients are basically in a survival mode. If you place anything in a survival mode, new materials, you're probably backfiring at one point. So we need to get them out of the survival mode, de-stress them, detox them. Obviously, we have to start by removing all the bad things in your mouth. And then after time, let's say 4-6 months, when everything is stable and healed, they are so much healthier. You can use way more different materials without causing any problems. So if they come in with a folder of like that big and 29 doctors they already saw, and then you think you're going to be the Messiah or the Jesus, you can help them and make them a new denture, which will then work, forget about it. What you have to do is make them as healthy as possible again. Like turn the clock backwards, see what has been done already, and restore everything. Luckily, we can help the body heal itself. And then at one point, you can place perfect teeth in the mouth.